to your home except for emergencies. That was a misreporting. And so I just wanted to clear that up before moving on. Now, what I would like to discuss this evening, I'm going to go back a couple weeks to actually Tuesday, March 13, 12, March 10th, I believe, 10th or 11th, whichever was the Tuesday. I got a call that my son had fallen at school. He banged his head, and my wife picked him up at school, brought him to the doctor, and they wanted him to get evaluated at Hasbro for a head injury, for a concussion. And so he was brought to the hospital. This was the first day that Lifespan, and I believe all the hospitals in Rhode Island, had implemented the no visitors policy for children, especially young children. They allow one parent to go. So I was unable to go, and I'm communicating back and forth with my wife to learn about the tests that they're doing and CAT scan and things like that. And during this time, I'm wanting to be there, but I can't because the hospital was already preparing then to take certain measures to ensure safety of the patients and to ensure that their medical workers, that everybody there is able to practice freely to treat the patients that they have. It's a busy hospital. It's always a busy hospital. And so later that night, we found out that my son was going to be staying overnight. I went to the hospital to relieve my wife, who had been there all afternoon with all the tests and everything. And in order for me to go into the hospital, she had to leave the hospital. They're taking precautions this seriously. And so I was in the waiting room of the ER, very busy ER. At that point, there were already some people in the ER wearing masks, and there were people coming in and out, very concerned, very flustered by both how busy the hospital was and also these new restrictions that were in place. My wife and I switched. I found out at that time that at the Miriam Hospital, my grandmother was also there. She had fallen and broken her collarbone, and she was in a different hospital, also a busy and full hospital, and also without visitors, without guests allowed to visit their family members. And our hospitals are among the best that there are. We have excellent people working in them. We have excellent administrators. Everybody, really from the top down in the Rhode Island healthcare system, are really superb, but they're also really busy. And this was 2 weeks ago. This was before a coronavirus hospitalization. This was our hospitals operating as normal, as standard practice. And that's the case throughout hospitals in the country. We have, in America, among the best healthcare providers and among the best equipment. But we also have a system that is built to serve our population. And our population has pretty typical needs. What we're all facing now is a very atypical situation. We all know that. We're all dealing with precautions regularly because of that. When we say we're trying to flatten the curve so we don't overwhelm the system, what's trying to be conveyed in that is that we don't have the capacity in our system to deal with surges. And I'm going to get to my quote a little early this time. This quote is from the press conference that Governor Raimondo gave today. It's, "We are not ready for a surge of cases, which means it's on us." It's on all of us to prevent the surge of cases. We're seeing it happen in New York. They are dealing with a tremendous surge. They fear there might be at the beginning of that surge. And they are doing everything they can to treat the patients that are in the hospital. But they are still, despite coronavirus causing more and more hospitalizations and patients needing more and more treatment from ventilators, what happens is they are filling the very few spots that remain in the system for everybody else. There's still going to be kids who fall and hit their head. There's still going to be seniors who need to go and get an injury checked out. There's still going to be heart attacks. There's still going to be broken bones. There's still going to be patients needing cancer treatment. There's still going to be any number of things that happen every day, every week, in all of our communities throughout the country. And we need our healthcare providers to be able to treat them as well as whatever comes with this virus. So everything we can do to slow the spread of this virus helps the next day and the day after that and the day after that. Because what we know about this virus is that as it spreads exponentially. For every person who becomes infected, if strong measures aren't taken, like the ones we're trying to take in our town, if strong measures are not taken, every person that gets infected can infect multiple other people. And so each day you have 2 times as many, 3 times as many cases that can come. And what we need to do by staying home is slow that spread. We're still going to have people who have to go out of the home, but we're also still going to have people who need to go to the hospital to get something else checked out. Somebody could be staying home, quarantining themselves, and still have appendicitis, or still develop bronchitis that needs to be treated. I don't think many people end up in the hospital with bronchitis, but I'm not practicing talking about medical issues. So what we need to do is heed the advice that we've been given, and we all know about the staying home and the 6 feet and not being in big groups. We need to do it. We need to buckle down and realize that it is actually very simple for us to take care of one another. It is very simple for us to save lives. It is not fun or glamorous, but it takes very little energy, very little effort. We simply need to stay home as much as possible. And I know that we can do that. What I'd like is, as these conversations, as these video casts continue to move forward, I'd like to hear back from folks about what topics you would like me to discuss and share, if there's any additional information you'd like. And so through this whole period I've had website up, I've changed it from banter to connect, because I'd like to connect with you. I'd like you to be able to connect with me. And so jacobbrier.com/connect is how you can send me feedback about things I've discussed, about things you would like discussed. And you can ask either any specific questions or make suggestions. You can reach out to me about anything even unrelated to this, just general questions about town. And I do hope to hear from you. Thank you for taking the time to connect with Jacob Brier. Please stay home and stay healthy.